Back to the UK, and on the screen I would like to welcome Victoria Hume, the Director of Culture, Health and Wellbeing Alliance in the UK, who will present Creative Health from Surviving to Thriving. Hello, Victoria.
Hi, thank you. It's great to be here. I'm so sorry that I'm not there in person, but I'm making up for it by being absolutely enormous in your auditorium. So I'll start by introducing my organisation. This is the Culture, Health and Wellbeing Alliance. We are the national membership organisation for creative health in England. So by creative health, I mean everything creative and cultural that supports health and wellbeing. We're supported by the Arts Council in England, and we've got 6,000 members who work across the arts, museums, heritage, as well as lots of people who commission and fund this work and research it. We have three main strands to our work. We do a lot of advocacy, so persuading policymakers and commissioners, for example, to invest in this work. We build networks for the people that do it, and we develop resources, both for practitioners and for people who want to understand more about how this works. And we do all of this through a network of regional champions, one of which is Derby Museums, actually, going back to Brenda's presentation, and about 50 national partners. So today I'm going to use a few case studies to touch on the relationship between culture and creativity and health equity, and also structures like social prescribing, which Karen introduced brilliantly earlier. I'm going to start, though, with the Bearing Foundation. So this is a charitable trust in the UK, and they're now in their third year in a decade of funding creativity, culture, and mental health specifically. And they're producing lots of really useful resources, reports, including this one, Creatively Minded at the Museum, which I really recommend. Apart from anything else, it has a brilliant foreword by Dolly Sen. So Dolly is a writer, filmmaker, an artist, a performer, an activist. She describes herself as disabled, working class queer, interested in disability, and in her words, the madness given to us by the world. And her foreword does she's worked a lot with museums. Her foreword does a brilliant job of describing the ways in which museums are beginning to challenge these historically unequal relationships with their communities by building meaningful partnership with people who perhaps have previously been objectified. She explains very clearly the primary importance of working with people with their own lived experience of the subjects at hand to achieve change. And she says, instead of labeling and interpreting my life once I'm gone, come to meet me and people like me. Let's meet in the middle. In a different way, this Curating for Change programme in the UK has been led by an organisation called Accentuate. And their aim is to change the workforce in museums, providing work placements and professional development for deaf, disabled and neurodivergent people who want to pursue a career in museums. They partner with 20 host museums, and they're also creating exhibitions like this exhibition in Hastings on the south coast, which aim to shine a light on disability heritage that may not have been seen before. So a lot of what they've done has been about changing and opening up employment processes in the museum so that people can be recruited more easily. And that's created a huge range of possibilities. It's already having quite a profound impact on the individuals who've been brought in as fellows, the organisations, and also the wider communities around them. So Dolly said that she wanted the subject of mental health to be looked at more politically than medically. She makes it clear that you can't take the politics out of health. In the UK, Michael Marmot has been a very influential scholar in this area. He's written significant reports on health equity in 2010 and 2020 and has since started working with individual regions in the UK. As you can see, he talks about what we call the social determinants of health, i.e. the conditions in which we are born, work, live and age. Marmot has pointed out that inequalities in life expectancy in particular have increased since 2010 in the UK. Just to give you some context, so there's huge geographic disparity in the UK between the richest and poorest areas. In Greece, you have a geographic disparity of about 2.3 years in life expectancy. In the UK, for men, the disparity is 9.7 years, and for women, 7.9 years. So this is a really pressing issue for us. These are Marmot's policy recommendations. So these are the things he thinks will allow us to tackle health inequalities, to build more equitable health. You can see how, in particular, that fifth bullet point, create and develop healthy and sustainable places and communities. For me, there's a very obvious overlay there with museums, arts and heritage. But if you look more closely at the other recommendations, you can find cultural and arts organisations tackling every single one. I'm just going to share 3 examples now. One is from a museum, another from a tiny arts organisation, and one from a different kind of cultural centre. So his first policy recommendations is about giving every child the best start in life. And I wanted to mention Manchester Museum's Muso Baby programme. This is a collaboration between a curator at the museum, a music therapist, and health and social care partners. It's been developed to support mothers experiencing anxiety or postnatal depression and their babies. And it's about encouraging an emotional connection between parent and child. Crucially, this results from a strategic commitment that the museum has made to health and wellbeing, just like Derby museums. So it's not just held in the education team. Health and wellbeing is a responsibility at all levels of the organisation, and it's that makes it much more possible to form stable partnerships with health and social care so that this kind of work can develop and grow, and so that there are proper referral pathways. You can see that after 7 weeks, these mothers' anxiety had improved, their relationships with their babies had improved, and all of this is, of course, critical to giving those children the best possible start in life. Moving on to his second recommendation, enabling all children, young people and adults to maximise their capabilities and have control over their lives. Here I'm going to talk about a project called Our Earth, Your Choice. This was run by a small arts organisation in the north of England called One-to-One Development Trust, and they've just won our Climate Award this year. So they're based in Wakefield in the north of England. It was a 2-year project, and a group of children came together for the first time to co-develop a computer game focused on climate change. This is some of the young people. Wakefield has within it some of the most deprived areas in England, and the young people came to this project with a lot of anxiety and fear about climate change, a sense of being powerless and unheard. And working together to build this game, you can see from the quotes, has profoundly impacted their confidence and their mental health. It's given them new skills, and it's given them an influential platform as climate activists. Along the way, they've also pushed the gaming industry forward by introducing non-binary characters of diverse ethnicities. Moving on to these two. So Marmot talks about fair employment and a healthy standard of living. I'm going to refer here to the Union Chapel Creative Community Leadership Programme. So the Union Chapel is a really interesting place in Islington in North London. It's still working as a Christian church, but it also is home to a secular charity that supports the local community. It's quite well known as a music venue, and it's very much a kind of cultural anchor for the area. And this programme provided paid training, and the paid bit is crucial, and mentorship to potential leaders from the community using something called legislative theatre. Now, many of you might be familiar with it. This is based in part on Brazilian educator Paulo Freire's pedagogy of the oppressed, and that in turn influenced Augusto Boal to develop theatre of the oppressed. Its roots are in the writings of Fanon and Karl Marx, so it's interesting to see it being used now as a mechanism by quite a few organisations around the country to improve policy making at a local level, something that has potentially long-term impacts on things like the work available in the area and the standard of living. One of the many important things about this approach, legislative theatre, is the way it seeks to create an equality of power between the community champions and the people who hold the keys to policy and investment. And the Union Chapel, as this cultural anchor, has lent its physical and human resources to supporting this process, acting as an anchor point between the two. I mentioned that the community leaders training was paid. This is a major shift that we're seeing more and more in the sector, and understanding that people just can't afford to give their time for free. So if we want to work with lived experience, if we want to develop and support this kind of leadership, we have to be able to support that expertise financially and to factor it into our budgets. The thing that binds these case studies together is partnership, and it's developing strong partnerships that is what is making it possible to tackle health inequalities. We saw this very clearly in lockdown. We gathered about 100 case studies, and about 50 of these were specifically about people who were shielding at home. So this was creative and cultural organisations delivering work. As you can see, 94% was in partnership, and this is what made it possible, for example, for social workers to deliver creative packs to the most vulnerable people in their communities. In fact, there's a lot of ambition at local government level to build on this and to work across health, social care and culture. One great example, again, is Manchester. The local government there has been working with the Health Equity Research Institute led by Michael Marmot, and has now become a Marmot City region. And just recently, it's become a creative health city region. So it's now using culture as one pillar of its work to address health inequalities. The bigger cultural organisations in the city, like the Whitworth or Manchester Museum, have played a leadership role here. But they also support the local cultural ecology, so they work a lot with freelance expertise, like the music therapist that I referred to earlier. Crucially, though, there is this active support from health as well. And the strategy that you can see the cover of here was published by the Greater Manchester Integrated Care Partnership, which is one of 42 new systems in the UK that are managing our health and social care. At a national level, in Wales, there's a different kind of policy facilitation. So the Wellbeing of Future Generations Act is now supporting cross-sector working, and the Welsh Health Service and the Arts Council are in their 4th year of formal partnership, and that in turn supports arts and health coordinators in all of the Welsh health boards. Again, the structural support from health as well as culture is critical to making this sustainable. To see why, I wanted to summarise a bit what we know about the sector from a few different pieces of research. So this work tends to be led, and this won't surprise you, by committed, passionate individuals. It's often people who have found creativity or culture to be vital tools to support their own health. It's a sector dominated by freelancers in the UK and small organisations, really tiny organisations. Even within larger institutions, like including the museums, it tends to be project funded and led by an individual, and there's not a huge amount in the way of support structures. So we end up with pockets of amazing activity, but not necessarily consistent provision, and often people working in isolation. And this lack of stability has a big impact on who is able to do the work, partly because it depends on using your own personal resources where you have them, so your existing social capital and financial capital, to make up for the lack of adequate resources in the sector. No one is paying you to network or build partnerships at the moment, so that happens on your own time. And that has 2 effects. One is a lot of burnout, and the other is a workforce that is not as representative of the diversity of the country as it should be. And it creates some challenges in relation to how the work is commissioned, particularly social prescribing. So Karen introduced this brilliantly earlier, so I will just add that social prescribing, I guess, goes back to this idea that health is socially determined. And we estimate that 20 to 30% of primary care appointments in the UK should be tackled with non-medical interventions. So that might mean sending people to a gym or to a debt relief organisation or to programmes that support access to nature or the arts. The current system relies on these link workers who help refer people into community support. It has the potential to be very effective. But the challenges come down to 2 things, really: money and infrastructure. At the moment, there's very patchy investment into the providers of this work, although literally this morning I've heard an announcement about some more investment coming online. But the link workers' caseloads are also huge, so it can be quite hard for link workers to understand what's available in the community, and similarly it's very difficult for small arts organisations to access a big health system. Where it does work, though, is with that strategic regional support that I mentioned earlier. So here's a good example of that. In Gloucestershire, in the south of the UK, for about 20 years, the local clinical commissioning group has invested in arts on prescription. And that's led to things like substantial drops in the number of people visiting their GP, reductions in hospital admissions. So a huge cost saving from that small investment. And this long-term commitment has helped build trust between local cultural organisations. And in lockdown, they came together and formed a new consortium, again supported with a small amount of investment from health. And this means that you have a group of cultural organisations who meet different needs in the community and take different approaches: circus, music, visual arts, photography. So when there is a need, it can be triaged out into these different organisations. And they're not working competitively. It means burnout is less likely because you have a network of peer support, it supports professional development, and ultimately it means more people in the community are helped. It's good to see that this ties in really well with the Culture for Health report that came out very recently, which was another sort of synthesis of studies across the European Union. So to try and tie this all together, of course, culture and creativity supports our health and well-being. You could say that they wouldn't be here if they didn't. It's a very human instinct to use our imaginations to build our cultures around us. In many ways, health is culture in that it is socially determined. But the question is, who is benefiting from it? If we start from understanding who is not well in our society, it tells us something quite profound about our culture and who it's including and excluding, who in the end is getting to exercise their imaginations. If we're able to work in partnership, though, with health and the wider community and with civil society to understand who's being left out of this dominant cultural story, we can start to build work that seeks to redress that balance and moves toward justice.
Thank you very much, Victoria. Do we have any questions? Please, over there.
Hello, and thank you so much. That was absolutely amazing, and I'm really glad you mentioned the Greater Manchester Combined Authority and the work they do. By the way, my name is Dina Diora, I'm a cultural manager. I'm sure you know the Greater Manchester Combined Authority. They produce creative care kits for young people, for teenagers who, particularly during the COVID time, they felt particularly isolated because not everyone has access to technology as we might think we do. So it really supported them when they couldn't have face-to-face interactions. And for me, it's very inspiring to see a local authority supporting this type of work and cultural organizations. So I'd like to hear your thoughts for the role of local authority, what in Greece we call municipalities, in different areas, and how they should be supporting cultural organizations to connect with more hard-to-reach communities through culture. Thank you.
Thank you for the question. I think local authorities or municipalities have a really critical role to play. And in fact, historically, certainly in the UK, a lot of the funding for social prescribing came through public health teams in local authorities. It wasn't called social prescribing then, but essentially they were supporting this work on the basis that there is a kind of preventative quality to investing in culture and creativity. So Manchester is one example, and in lots of ways they are leading the way. But there are a number of other local authorities in the UK doing similar things, all in different ways, and it has to suit the priorities of the area, obviously. In Cornwall, for example, there is a partnership between the public health and culture teams called the Creative Health Partnership, and I think they're aiming for something quite similar to what's happening in Gloucestershire. They work very closely with a local network of arts and health providers. So I think that the main thing I would say is that it's about partnership within the municipality between people who are focused on different areas like culture and health, and that's what tends to give it strength. We have seen a lot being written into cultural strategies about health. What happens less is having stuff written into health strategies about culture. And I think that's something that we're trying to tackle at the moment in the UK. The National Centre for Creative Health is working hard to try to get integrated care systems to commit to cultural approaches in their work. So for me, that's the key, to get this held between the two rather than it always being held in culture. I hope that answers the question.
Thank you. One more question on the back, and then we move to our next speaker.
Thank you very much, Victoria, for this amazing presentation. My name is Marlene Muglio. I'm a professor of museology, and I want to ask, taking into account that these projects, these programs are long-lasting, they have a lot of years of experience, so I would like your opinion. What makes these social prescription, these long-lasting programs successful? What are the key ingredients that can maintain the sustainability of these projects? Because often we start something, it goes very well, but then there is no continuation, which is a downgrading, is even worse than at the beginning. So what is the key magic factor?
If only there were one key magic factor. It's a good question. I think the things that we have seen to be enablers in the sector are actually the people who drive it. So it often comes down to the commitment of the individuals. And there are pros and cons with that. But looking at the work we did in relation to understanding how creativity and mental health worked, even though people said it was incredibly challenging and difficult to get funding, difficult to have your work taken seriously, most of them had been doing it for 15 years or more. So people just battle on. But that, as I say, that does impact who has the capacity to do the work, which is not a healthy situation. One factor I would say is something to do with being embedded in your community. So we saw during lockdown that some of the organisations who were able to keep going were the really strong local relationships and were able to sort of change their practice very rapidly, but maintain their relationships with those communities. So in many cases, people stopped doing any creative work, but they kept telephoning people that they knew had worked with them in the past, and it became a sort of lifeline. Well, it was a lifeline, I think, for a lot of people. But that was to do with having a very strong presence in the community. I think what works less well is sort of parachuting ideas into different locations that don't have a root there, or don't have roots, or at least don't have local partnerships. So there's something about being embedded. There's something about giving space to the people who are committed to the work. But ultimately, we need much more long-term investment and to move away from this project-funded model.
Thank you, Victoria. I guess it's a matter of building trust.
Yeah, exactly right, yeah.
Well, thank you very much for being with us from far away.
Thank you, honour.
Hope you'll be able to listen to the next talks, and we'll